giving total parenteral nutrition at home. Your physician has ordered TPN to meet your specific needs for IV nutrition at home. HomeMed, Michigan Medicine's home infusion pharmacy, will make your TPN bags. Organize and pack your IV supplies and equipment, then deliver them to your home each week. Upon receipt, you should check your supplies for damage, leaks, and color changes. Read your prescriptions and medication labels carefully, checking your name, the medication name and dose, how the medication should be given, and the expiration date. Store your supplies and medications properly, and assure your pump is charged. At the start of care, you will receive a HomeMed Home Parenteral Nutrition Manual, along with instructions for adding medications to the TPN bag. This video demonstrates preparing the TPN bag, preparing the IV tubing and pump, starting your TPN infusion, stopping your TPN infusion, and daily monitoring. Preparing the TPN bag. Allow your TPN bag to warm to room temperature. You will need to check your prescription to see if you will be infusing a clear bag or a white bag with lipids. Check your prescription to see what medications you will need to add, but do not add them sooner than 1 hour before you infuse the TPN bag. Choose a proper work area and clean your work surface or laminate mat with household disinfectant. Let the area air dry. Next, wash your hands. Wet your hands and wrists under running water. Scrub vigorously with soap for 15 seconds. Work the lather between your fingers, under your nails, and over your palms and backs of your hands. Rinse your hands well by keeping your hands up with fingers pointing towards the ceiling so the dirty water runs towards your elbows. Dry your hands with a clean paper towel from the tips of your fingers down. Turn off the faucet with the paper towel. Gather your supplies and place them onto your work area. Your supplies will include your TPN bag, multivitamins 1 and 2 with a 10 milliliter syringe for each vial, any additional additives, 1 saline syringe for use before your infusion, sapphire pump tubing, an anti-siphon valve, an additional saline syringe, and 1 heparin syringe for use after your infusion, alcohol pads, sharps container, alcohol caps, and the sapphire pump. Wash your hands again or use an instant hand sanitizer. Check the vials for medication name and expiration date. You will need to add both vials to the TPN bag. Remove syringes from packages and check to be sure the needle is securely attached to the syringe by twisting the needle to the right. Remove the flat disc covers and scrub the top of the vials with an alcohol pad for 15 seconds. Holding a syringe upright, pull the plunger down to draw up air. Remove the needle cap and inject the air into the vial. Keeping the needle in the vial, turn the vial upside down and withdraw the liquid from the vial. Make sure the liquid is covering the tip of the needle. Remove the syringe and recap the needle. Repeat the steps to withdraw the second vial of multivitamins. Remove the red foil from the injection port of the TPN bag. Scrub the injection port with an alcohol swab for 15 seconds. Remove the needle cap from the syringe and add the multivitamins through the center of the injection port. Discard the syringe into the sharps container. Repeat the steps to add the second syringe of multivitamins to the TPN bag. If ordered, you may need to add other medications to the TPN bag, such as famotidine or insulin. You may need to add a sharp needle to add a medication in a syringe to the TPN bag. Or you may need to use a syringe with a needle attached to draw up a medication from a vial in order to add it to the TPN bag. Gently knead the bag to evenly distribute the multivitamin. Invert the bag a few times while mixing without shaking the bag. Now you are ready to prepare the IV tubing and sapphire pump. You will need sapphire pump tubing with a filter and an anti-siphon valve, as well as your pump and pump programming sheet. Turn the pump on by pressing the on-off key in the lower right corner. Review the TPN program settings along with the bag label, prescription, and pump programming sheet. If correct, press OK. Remove the anti-siphon valve from the package by holding the clear center piece. Remove the short round cap on the end of the anti-siphon valve. Take the cap off the end of the sapphire pump tubing and connect the anti-siphon valve to the open end of the sapphire pump tubing. Open the safety door on the sapphire pump by using your thumb and pressing the door outwards. Insert the IV tubing cassette into the pump by placing the saddle on the round metal anchor and clipping the upper end of the cassette into the metal lock. Close the safety door and ensure that it clicks upon closure. Remove the tab on the middle port of the TPN bag. Keep the spike sterile, removing the spike cover from the IV tubing. Do not touch the spike. Hold the port straight and insert the spike by pushing and twisting at the same time. Now you are ready to prime and remove air from the IV tubing. Loosen the cap, being careful not to remove it. Press Prime in the lower left corner of the screen. The pump will prompt you to be sure the tubing is not connected to you. Press Prime again, and the pump will begin to prime with IV solution. Hold the pointed end of the filter in an upward direction while priming until fully filled with fluid. Once the pump has stopped priming, check to be sure no air remains. If air remains, repeat the priming steps. Starting your TPN infusion. Now you will need to flush your IV catheter with saline before starting the TPN. Unclamp your IV catheter and remove the green cap. Scrub the end of the catheter with an alcohol pad for 15 seconds. Hold the saline syringe upright. Do not remove the cap and press forward on the plunger to break the seal. Tap the sides of the syringe so the bubbles rise to the top. Remove the cap and push the plunger to remove all air. Push and twist the saline syringe into your catheter cap to the right until secure. Inject the saline solution. Remove and discard the syringe in your trash. Scrub the end of the cap on your catheter with an alcohol pad for 15 seconds. Remove and discard the protective cap from the end of the IV tubing. Push and twist the end of the IV tubing into your catheter cap to the right until secure. Press Start on the pump screen to begin the infusion. Press Lock, then Patient Lockout on the screen to prevent accidental alarms and pausing the pump during infusion. Place the IV bag and pump into the backpack or use the IV pole. At the end of the infusion, the pump screen will display Infusion Complete. Press Mute, then OK on the screen. Press to unlock patient. Enter 8880. Press OK. The screen will display Authorization Level Medium. Press OK again. Turn the pump off using the on-off key. The screen will display Press Off to turn off the pump. Press off on the screen. Wash your hands. Disconnect the IV tubing from your IV catheter. Scrub the end of the cap on your catheter with an alcohol pad for 15 seconds. Remember to push the plunger on the saline syringe to break the seal and remove the air. Flush your IV catheter with the saline. Repeat these steps with the heparin syringe, remembering to push the plunger on the syringe to break the seal and remove the air. Leave some heparin solution in the syringe. Clamp your IV catheter before removing the syringe. Place an alcohol cap on the end of your IV catheter. Remember to prepare for your next infusion by charging your pump and taking your next TPN bag out of the refrigerator to bring to room temperature. It is important to pay attention to how you are feeling and follow your clinician's specific instructions for monitoring. You will be asked to check your temperature and report fevers. You should check your IV site for any redness, swelling, tenderness, or drainage. You may be asked to measure your weight, your oral intake, and your output. You may need to check your urine for the presence of sugar or your blood sugar with a glucometer. You can keep a record of your results on the daily monitoring forms in your HomeMed Parenteral Nutrition Manual. You may be asked to bring this information to your clinic appointments so your physician can review it. HomeMed clinicians will obtain your lab results and call you to discuss them, along with evaluating your progress. Giving TPN at home takes organization, preparation, and monitoring. HomeMed is available to help. Please call us for any questions or concerns.